am Ken Hackshaw, and welcome to another installment of Risk Unfiltered. I have the distinct pleasure and privilege to have Dr. Joy St. John with me today. And as we normally do, we'll ask Dr. Joy, as most of us call her, or as I call her, to introduce herself with a bit more emphasis on what she does and from whence she came. Dr. Joy, welcome to Risk Unfiltered.
Thank you very much, Mr. Hackshaw.
So
It's
tell
my
us.
pleasure to be with you and to let you know who I am. My name is Dr. Joy St. John. I'm the Executive Director of the Caribbean Public Health Agency, a specialized agency for public health of the CARICOM community. And CARPHA is just 10 years old. We recently had a birthday. And it's almost like a one-stop shop for public health, including environment, including medicines regulation and testing for quality of medicines. We have lots of interesting things in our portfolio. And we are happy to serve 26 member states in the CARICOM region and a little beyond.
Great. So, Doctor, it would be remiss of me if I don't ask the following question. So, CARPHA having been named Risk Management Company of the Year, and congratulations to you and your team.
So chuffed. I think it's a fantastic thing. Thank you so much.
How has that changed? So, how, if anything, how have you then shared that with your employees to let them know that they have been rewarded for the work that they would have done in the risk management space and by the leadership of you and the other executives?
Well, I shared the pictures of the award and the notification of the award with the staff. I'm going to have a staff meeting soon, so I'll talk about it then. And I'm making sure that risk management has a very prominent part in the office of the executive director, but that's
brilliant.
Coming events. That's something
brilliant. So do your, and these are my words, do your competitors know that that CARPHA was awarded Risk Management Company of the Year? And by your competitors, I call them, you know, your colleagues in the PAHOs and the WHOs and.
No, Mr. Hackshaw, I have not gone on a media blitz of it. I put it on LinkedIn. It was on, I put it on Twitter. It was on LinkedIn, but I haven't done a media blitz.
Okay.
We did do I think we did do a press release, but if you would like me to do a media blitz,
no,
you need to tell me what's the risk of doing that.
No risk whatsoever. I mean, the jealousies and the envies will come to the fore, but that's a beautiful thing. And that's
No, we do not discuss jealousy and envy at CARPHA. We talk about trust and relationship building and partnerships. Those things are just fleeting emotions that we do not entertain.
Okay.
And we try to explain to our colleagues in the CARICOM space and in the wider region of the Americas how we do things.
But the risks remain. So let's move on. So public health. So I'm going to ask you a two-part question. What concerns Dr. Joy St. John from a public health perspective, personally, and what is CARPHA's, what keeps CARPHA up, if it's separate from what keeps Joy St. John up?
Well, you said personally, and as soon as you say personally, I'm going to share something.
Brilliant.
The biggest public health concern anywhere in the world is chronic non-communicable diseases. So personally, that concerns me. I have chronic non-communicable diseases. It has not affected my work output or the quality of my life, but it concerns me from the position of the executive director to see that so many Caribbean people, even youth, are getting at least one chronic non-communicable disease in their lifetime. And as soon as you're talking about youth getting chronic non-communicable diseases, you know immediately that quality of life is affected. In fact, globally, this is the first generation which might be less healthy than its parents.
Wow.
And its parents may have to bury the generation before their lifetime is over. And you have to look just at what happened with us with COVID-19.
Yeah.
Even young people with chronic diseases either had severe illness or even died. So you realize that this is a major concern, that there's so many of the risk factors of chronic non-communicable diseases rampant in the community. We're talking about obesity. We're talking about cigarette use increasing even in young women. We're talking about the effects of stress. We're talking about alcohol abuse. So there's much too much for us to be looking at in terms of the negative when we live in such a beautiful geographic region.
Yeah.
With so much intelligence and understanding of the world. We should not be looking to eat in a way that puts us in harm's way. What keeps CARPHA up at night? We started getting the weird and the wonderful. That's what I call it. But there's a re-emergence of diseases that we thought had been put aside and controlled. The re-emergence around us in the region of the Americas. I'm talking about things like measles.
Yeah.
I'm talking about leprosy. I am talking about cholera. I'm talking about malaria. And we have started detecting these, usually imported cases. And then there is the introduction into our part of the world of diseases that we thought would never get to us. I'm thinking Mpox, which was formerly monkeypox. That has been introduced into the Caribbean region. So we are concerned because, as you know, one of our programs and a novel program is the Tourism and Health program. Yeah. And with our dependency on tourism and trade and travel, there's also the risk of importation of diseases. So we're concerned not only because we're detecting them, but we are worried that our health systems, which are small and under-resourced, are going to be hard-pressed to control, first detect. Early warning and response is important. First detect, then isolate, and treat so that there's no spread in the neighborhood, in the country, and across the region. So that's what we're worried about.
So, Dr. Joyce, I sent out an email about a week ago referencing that fact, but not based on anything I knew happening within the Caribbean, because the re-emergence of these diseases are happening in the outside world as well. And so based on that, I basically said, managing risks is also about looking in the rearview mirror, because that which have passed may also come back.
You got it. You got it.
Yeah, but I have not read anything within the Caribbean, and I'm an infomaniac. I read newspapers from all over the Caribbean. Other than monkeypox, I have not read that any of these age diseases have reemerged within the Caribbean.
Well, we have been seeing isolated cases. We have not got to the stage where we've got local transmission. And that's probably why you're not hearing it. But in CARPHA, because of our laboratory, we're detecting it.
Right. But shouldn't that be out there, though, respectfully? Because all of these diseases are highly communicable diseases, eh?
CARPHA operates at the regional level. We advise the member states.
Okay.
The national actions are taken under their purview. You know about Mpox.
Yeah.
Don't call it monkeypox, that will age you. that will show that you're not up to date. You know about Mpox because the member state that detected them recently not only alerted the public, but told the public what it should do. So think twice about what you said. You had the right national action with Mpox.
Okay.
And behind the scenes, CARPHA did a testing protocol and advised our member states. Last week, we had a regional health security meeting where we brought together quite a few. I think there were 17 chief medical officers, our representatives. We brought together several of our member states, not just with us, but also with partners and with funders. And we talked about the things that are worrying the member states, the needs that they have. And so we are preparing for what keeps us up at night, ensuring that the health systems of the region are prepared and can get additional resources, because you know that the pandemic fund had its first round of proposals, and out of over 120 proposals that were submitted, only 19 were funded. And one of those is the regional proposal that CARPHA put forward. We are one of only 3 entities that had multi-country proposals. And with us, it was regional. So even if a country didn't go with us, we will find a way when we're helping everyone to help that country. So we were also discussing how we could best support the member states with that. So don't get excited, Mr. Hackshaw.
Well, no, I'm paid to get excited, but let me push the envelope a little bit. So if you detect one of these diseases and you pass the information on to member states, and whether they decide not to,
they never ignore.
Well, no, not ignore
action in place, even if they do it quietly. Are shoring up the let's talk about the barriers. They're shoring up the barriers that will protect the country. So
yeah.
And then from the regional perspective, we are supporting with the regional ring fencing.
Okay, but with CARPHA, hypothetical, something you learned when we did our program, scenario analysis. What if? So let's say you detect something, and let's put it in context. One of the big problems with when COVID hit, that there wasn't enough early communication or sharing of information, right? So whether it's from China or wherever, so it wasn't.
Oh, you mean from the global perspective?
From the global perspective, yes. Right?
That was an issue, yes, but
Brilliant.
not in the Caribbean.
Okay, so it's a hypothetical. So we're back in the Caribbean, and it's a very good possibility here. So you detect something, you share it, but that information is not then shared with the requisite island territory. So whether it's Jamaica, Trinidad, Guyana, or Barbados. And so CARPHA says, wait a second, why isn't this out there in the public? Can CARPHA then take it upon themselves to put something out in the public that, hey folks, however it's done, that we have detected this? Can you supersede the member states by putting information out there, communicating what you have found? If you find that they're a bit tardy in their communication of this potential risks?
We can discuss the risk generally. We do not usually out a member state.
Okay.
But there are certain criteria and stipulations if we think there's danger. We're not isolated. CARPHA is not an entity unto itself, and we're in the field of public health. So there are global governance structures, PAHO, WHO, if certain criteria are met, that we can alert those systems. But we usually advise generally without necessarily saying a particular country had an issue, and we
Okay.
work with them behind the scenes to make sure that they're shored up. You have no idea, for example, some of the things that we put in place because we had international games. You
Right.
have no idea, for example, some of the plans that we are thinking of because we're going to have Cricket World Cup going forward. But things, I am hoping, will go very smoothly, not just from the perspective of enjoyment, but also from the perspective of disease prevention and control.
Okay, so and I love this because it's a nice segue into what we call horizon scanning. So let's say you have international cricket coming. Are there any, and you don't have to necessarily answer with specifics, but from your surveillance methodology, medical surveillance. So so you have to do I'm suggesting CARPHA will probably do a horizon scan noting the countries from which these players will be coming to try and identify what is happening within that country specific to public health or anything that could then be brought into the Caribbean. And then do you then put things in place to test those things from those particular regions?
It's a nice start you've given there. CARPHA does not work. No, I'm not being facetious. CARPHA does not work in isolation. We are part of the security cluster of Caribbean. Right. And when we last had Cricket World Cup, I, as a young chief medical officer, had responsibility for working with other entities to ensure the security. I was responsible for the health security element. So we're going to work within the cluster, and we are going to do that level of scanning with interplay, almost like we're going to create a matrix of risks and threats. And we prepare to suit. It's not just about testing for disease.
It's a bigger
lab is just one of the armaments.
Right, but since we're speaking with you in the public health space, we'll focus on your expertise and leave the other national security aspects to when I have conversations.
No, don't be that narrow. It is narrow thinking that gets you in trouble.
No, but you wouldn't know, Dr. Joy, respectfully, of what the national security arms will be specifically doing. You will know from the public health perspective. What I mean, or you may.
There is a regional space for security.
Okay.
And there is interplay of surveillance systems, health surveillance systems, security surveillance systems, which when brought together will make a stronger ring fencing. It would be stupid of me to not do something that was done in 2007. Right. Because in 2007, we worked together so that if there was a health threat, we could track it through the space.
Okay.
So the overall security work is not about snooping on people. It's about strengthening that ring fence that we normally have around the CARICOM space. So it wouldn't be just testing, it would be surveillance. What are some of the syndromes? Are we seeing rash and fever? Are we seeing rash and unconsciousness? That will give us an idea of the types of diseases that may be circulating or may have been introduced as a point source, and we need to wall it off. And of course, there is a preparation of the kinds of equipment, material, and supplies that would be needed in the host countries, and also the kinds of systems, because we're expecting an uptick in tourism generally, not just for the host countries for the games, but a participant, a visitor may decide, oh, I'll visit Island Z. It's not one of the quick, but I've always wanted to see Island Z. So we are looking at how we can best optimize our preparation from that broader holistic perspective.
Brilliant, brilliant.
No, it's not brilliant.
Yes, hard work.
Brilliant. It's health security 101.
But it's a brilliant. So I tell you why it's brilliant, because in many spaces, and I know this intimately, and then we'll move on. Things are sometimes done too much in silos,
No,
right?
it doesn't work in the Caribbean.
But in this case, you're speaking to all hands on deck approach, which is a beautiful thing. But
Well, it's what we did for COVID. We involved sectors other than health, and we had a better passage through. In fact, the pandemic is still on, but
yeah.
COVID is no longer a public health emergency of international concern.
Right.
We don't want anything starting in our space that then goes on to be a public health emergency of international concern.
Understood. So you're very proactive, or CARPHA is very proactive in their approach. So I want to ask you specifically about one of those proactive methodologies. But before that, I want to give you kudos for mentioning both risk and threats, and they are very different. So kudos for saying that. Most folks say, well, the threats to this, but you mentioned both risk and threats.
But the security cluster has a risks and threats table with different tiers of seriousness, which will then trigger different levels of response.
Okay.
So it is our bread and butter.
I would love to see the risk and threats and what differentiates it. Okay, so let's speak about something that I would have learned from my time with CARPHA, and that I subsequently went on to have more conversations with a colleague of ours, Dr. Kirk Douglas, and then some folks on the outside. There's this doctor, epidemiologist from South Africa I was having a conversation with. But where are we, or where's CARPHA in the Caribbean with wastewater testing to detect problems or to detect any possible diseases that may be not yet manifested itself, but could be around, but not identified? Where's
we have 3 campuses.
Right.
Campus in St. Lucia is environmental health and sustainable development, and that is the location of one of our 3 labs. You spoke about testing for organisms. That's the medical microbiology laboratory. We have an environmental laboratory, which is also accredited. All 3 of our labs are accredited. And so we do water quality testing, not normally wastewater, and the kind of things that I think you're talking about, like what was used for tracking COVID-19 in the US. In some instances, they checked wastewater to see if they were detecting COVID-19. CARPHA doesn't do that, but we do environmental samples, air, water, food. We do that testing. But this whole thing about testing, for example, sewer water and that kind of thing, we have not gotten into that. We're not rich, so we're optimizing resources for. But from the risk analysis perspective, we're optimizing our reagents and so on for the best yield.
Okay, but is that something that if resources are made available, that you think CARPHA should be involved with, or be part of the area of testing that ought to be done?
What I would first like to do would be research to see how in the Caribbean setting, if it really is value for money. You know that we have a research arm coming out of my office.
Yeah.
But we have a research arm, and we do ethical research. We actually have research ethics network that we support. So I would prefer to go the research route with that, and check on that first before I start waving the flag. CARPHA is testing wastewater.
Well, the reason I sort of like jumped on that is based on the conversation I was having with this epidemiologist. And you mentioned the word tourism and tourism health. I remember having conversations with Dr. Indar about this as well. When the ships come in, isn't I mean, what's currently in place? And I don't know, as the reason I'm asking, to further ensure as best as CARPHA can, or mitigate the risk of anyone bringing with them any diseases. What
Oh,
can be done, or what is being done in that space?
there's an actual protocol when it comes to cruise ships and monitoring diseases. And there's supposed to be a report by the ship's doctor sent ahead before they actually come to the country, stating the level of any disease, stating what measures they have in place, if they're persons who are ill, if they're quarantined, if they're isolated, if there's been testing on board. All of that is supposed to come in a report that is reviewed by the country's normally port health staff. So that can then be verified if they come on board and check these things. This was in place during COVID-19. It was in place before COVID-19, when you had norovirus outbreaks for years. But during COVID-19, there was a protocol developed and accepted by the chief medical officers, which was used. So that is part of our armamentarium for checking cruise ships, but it also works for other vessels. When a plane lands and it waits, it's waiting because its report has to be reviewed by the environmental health, normally the port health. So the vessel can be one that comes by ship, and the vessel can be one that comes by the air. These are protocols that are in place. They are tweaked, they are expanded if there's a global alert, like what was happening with COVID-19, and different indices are added. But that kind of checking goes on every day, all day.
Okay. Well, yeah, as a risk practitioner, I'm always wary of current procedures that may not be as robust as needed for future occurrences. But we'll set that aside for a second. Let me ask you this.
No, that's where CARPHA comes in. You were talking about scanning the environment,
right,
and beefing up protocols or putting in place protocols if there are issues of concern. We do that kind of thing. Okay. So if, for example, Mpox was circulating in the Americas, as soon as in the Caribbean, we started getting notification of cases, we improved the testing protocol for Mpox. So we scan, and we usually convert what may be a protocol in the international circles to something that is Caribbean relevant.
Brilliant. Brilliant. So staying with that topic, and this ought not to be a difficult question, is the Caribbean, through CARPHA, much more prepared to handle the next pandemic? Not if, but when, in whatever form it comes, happens.
The Caribbean through the intervention of CARPHA, through the intervention of PAHO, through the funding from World Bank, EU, we had so many entities and also countries shoring up the resources. Some are the human resources, so we have people who are better trained. We've got in CARPHA something called the Field Epidemiology Lab Training Program, where we train teams of people from countries so that they can deal with these things. So yes, COVID was a wonderful way of increasing knowledge, the actual practical experience, as well as getting resources, material, equipment. The European Union pumped a lot of money into the Caribbean. We procured equipment, sent it all around. We also got help from Spain, South Korea, China, Romania. You wouldn't believe it, the people who helped us.
So is that a yes, that we are, as a Caribbean population through CARPHA,
It
is
was
now?
a long yes. You couldn't recognize a long yes.
Well, no, you say yes and then you qualify. Yes or no, then you qualify. I learned that in law. So, okay, but you are allowing, obviously, with all of this, yes, or the more prepared we are, or CARPHA is, you are allowing for still the uncertainties, right?
Listen, you can be prepared up to the hilt, but if
Right.
you have a novel disease like COVID-19 was a novel disease, there's some things about it that you just wouldn't know.
Okay.
And so this whole issue of early warning, detection, surveillance, monitoring what is happening with the diseases, so you get to know what it's like for your population, for the Caribbean population, is a very important part of public health.
Okay, and you are, as the executive director and leader of CARPHA, you're I don't want to use satisfied, but you're confident that we are in as good a space as we possibly can from a public health standpoint.
I would never say that.
Because there's always
I have less of a concern than before, because not only did we get the shoring up, but we got the experience of living through it and bringing our populations through it. But I would never say that I would relax. Never.
I didn't use the word. I said you are confident in what you now
Put
have.
aside that word, Mr. Hackshaw.
I could never relax. Our jobs don't allow for it.
Put aside the confidence, Mr. Hackshaw.
Okay, all right. Okay.
Never. I will always have a sense of wondering what could go wrong. There was a lot of turnover during the pandemic. You know, the rich countries came to the Caribbean and took our nurses. They took our doctors. So there's always that thing of, you know, trying to train the people who weren't there at the front line.
Right. You know what? So you did not walk into my trap, because confidence sometimes turn into complacency. So had you said, hold on, had you gone,
trap me.
Well, this is Risk Unfiltered, eh? So it's not a trap, it's a test. Remember, that's something we do well. We want to.
But this is not my nature. I am not someone who is boastful. I am not braggadocious. It is my nature to be cautious.
Yeah, but I also need you to be a little bit braggadocious from a CARPHA's perspective. And you and I had this conversation many moons ago. So let's move on from there. So kudos to you. You know, your RQ, your risk IQ is way up there. So it's no wonder you guys won Risk Company of the Year, primarily because of the leadership. What's the next step for CARPHA in ensuring that the Caribbean population stays as safe as it could be, given the emergence of some of these diseases and what is yet to come?
So the successful implementation of the plan as funded by the Pandemic Fund, that is going to go so far with helping the Caribbean. So we are awaiting the commencement. There's some things that need to be put in place, certain documents and so on. The IDB is our implementing entity, so we're having meetings with them. I have to confess that when I say we, it is not including me, because I am the vice chair of the technical advisory panel that actually reviews the proposals. So I have to have, I'm right now working on creating a parallel system, so the implementation is not under my remit or purview. So when I say we, the team that's dealing with the Pandemic Fund is having the meetings with IDB and so on and so forth. But the successful implementation is going to go a long way towards ensuring Caribbean solidarity to deal not even with anything as florid as a pandemic, but there are always outbreaks. There's always a risk of something weird and wonderful coming in and causing serious harm. So we are working on ensuring that there isn't that chink in the armor that a disease could come in and cause issues with our member states. The pandemic fund is dealing with communicable diseases, but we're still working on NCDs. We're still working on climate change. We're still working on tourism and health. We're still working on vector-borne disease. So those things that are non-pandemic fund, as I told some of the staff, I'm going to go into a gear they have not seen before to try to make sure that these things are strong.
Brilliant. And I have every confidence that you will do so.
Mr. Hackshaw, how can you have confidence?
I know a bit about you. It's a few years now we have been having these conversations, but
2 years, Mr. Hackshaw.
So let's end where we started on non-communicable diseases. And you spoke about somewhat of a personal experience. What can CARPHA do, or what is CARPHA doing to help, especially from the youth perspective, right? Because those are our future leaders.
Lovely. Yeah? I'm so glad you came with that. So CARPHA has worked with our partners in the Organization of Eastern Caribbean States Commission on Diabetes Guidelines. That was done the year that I joined, just before I came in. And then more recently, last year, we worked with PAHO, and we worked on updating the hypertension guidelines. So they are soon going to be released. In this iteration of the guidelines, there is a lot of focus on persons who have diabetes, how we can empower them. And then we also created a set of focal points: mental health, nutrition, and chronic disease. We brought them together, training them up, supporting them with their work, and then the ultimate, a non-communicable disease surveillance system accepted by the chief medical officers, so we can measure what gets measured gets implemented. So these are the coming events. And when it comes to young people, we have been working with Healthy Caribbean Coalition, and Healthy Caribbean Coalition has a whole youth arm. And we are also working on a 6-point policy package, which is supposed to be reducing obesity in children. So we are working with our youth arms, not just with HCC. There's also the CARICOM Youth Ambassadors that we're working with. And we're also working on something called Caribbean Moves, which is an adaptation of Jamaica Moves, which is also going to be focusing not just on movement, but also good eating habits and this whole issue of well-being. And then close to home, CARPHA has started CARPHA Moves. And we are working on this whole thing about workplace wellness with our regional communication network focal points in all of our member states. So we're trying to spread this whole issue of wellness rather than sickness.
Yeah.
And we're working to make sure that we try to do what can prevent rather than treat what has already happened. Brilliant. So a lot of common events with non-communicable diseases, and hopefully a lot of good work with young people.
Yeah. So to that end, CRMA has a program we call Risk for Teens, where we go out and meet with students or teens in the police youth leagues and stuff. What I would like to ask or offer is maybe if we can get some speaking points from CARPHA, or if CARPHA has a person who's available whenever we going out, I would love it for it to be you, but you're all over. You're like Carmen Santiago. You're like all over the place. That's
Not quite, not quite.
where in the world is Carmen Santiago? But so when we meet with teens, is to speak to them about the difference between risk and threats, what vulnerability versus resilience, in a very palatable way, and it's a tremendous success when we do that. So
Well, we have a very strong social media presence.
okay,
And we understand about packaging information in short, snappy bits. So
okay,
once you start working with us, we could work with your group
brilliant.
and
And
give
so
them some of the tips.
yeah, and but again, we actually go out and meet with them. So either, and we will continue this conversation because I think that part of what you just spoke to sort of like is a nice, it's all part of managing youth risks, right? Both from a personal youth perspective and a family's perspective. Because if a member of the family that's young is impacted, the entire family for the most part could be impacted. We'll do a sidebar and we'll continue this conversation, and my folks who are listening will make sure to tag that uh, Ken and Dr. Joy to have conversations around risk for teens. And then whenever I'm in country and you're in country, we go and actually meet some of these youngsters, and it's a beautiful thing. It is a beautiful thing. I'm always inspired when I leave them, just as I'm inspired whenever I have conversations with you, whether virtually or in person. So I want to thank you, Dr. Joyce and John.
You're
I
welcome.
always learn something. Seriously though, I always come away more knowledgeable and intelligent from a medical or public health standpoint whenever I meet with you, and that's the God honest truth.
Oh, that's great. Thank you so
Yeah.
much. That wasn't my aim, but that's great to know.
It wasn't your aim to educate me or to what?
To make you more intelligent, Mr. Hackshaw.
We gotta do this. We gotta do this at time, but I know you're busy and I have stuff to do as well. So I want to thank you so much, Dr. Joyce and John, for taking the time to be on Risk Unfiltered, and our paths will cross again soon, I hope.
Yes, I hope so. You take care.
You take care too.